So that's an excellent question. We initially, in March, when we started this and knew very little about what is the course of transmission, we shut everything down, including outpatient clinics. And our fear was that our hospitals were going to be overrun by the normal course of care, and then COVID would spread like wildfire. And oh, by the way, we didn't have enough masks and gowns to protect our healthcare workers. So the initial lockdown bought us some time, and it also bought us some information. And what we've learned over the course of this is if we're adequately masked and protected, the risk of transmission is very, very low. And what we've noticed here locally is the risk of transmission to healthcare workers is far more in Mississippi in a social setting than it is in the healthcare setting. I'm safer here at work where I'm going to be masked, and I'm only not masked right now for the course of this interview behind a closed door in my office, but I'm going to be safer here than I am when I leave here and go home and do whatever I do outside of work. So what we were able to figure out over the course of this time period where we were able to lock down is how it spread, how we can protect ourselves. And here locally, we've had the good fortune of truly developing a regional center of excellence in the Cough and Fever Clinic, where all of our potential COVID cases in the entire Hattiesburg Clinic and Forest Health system is being routed to that center of excellence. So what that has allowed us to do is take our other medical offices and allow them to conduct business as somewhat usual. Now, somewhat usual in that you're still going to be asked to be screened before you walk in the door. Everybody needs to be masked before they walk in the door. And then that allows a cardiologist to continue taking care of their patients, our endocrinologist to continue taking care of their patients, and our primary care to continue doing the preventive and the chronic health maintenance that we need to. What we've determined is people are putting off that care. And there's some lag time before that catches up to you. But we're not catching as many cancers as we were pre-pandemic. And those are still out there. Those risks haven't changed. We're not seeing as many people in chronic care management who have diabetes and who have heart failure and who have COPD. Those people still have those illnesses. So now it's time to be a bit more surgical about our approach. And we have fortunately have had the system in place to be able to keep our other medical offices safe while a group is handling our potential COVID cases. Even if that were not the case, most every medical clinic now is screening and has mandatory masks for both the patients and the providers. So that makes it a relatively very safe place to be. And I would encourage people, as we start getting into the latter part of the year, especially as we come into flu season, to start looking forward to getting that preventive care, especially to get your flu season. And if you ask me what other thing we can do this year to help, in addition to wearing masks, is please, when the flu vaccine is available, please go get it.